and good morning, everyone. Happy National Poison Prevention Week this week from the Missouri Poison Center. My name is Amanda Ruback, and I am a nurse and the Community Outreach Coordinator here at the Missouri Poison Center. And today I have with me Julie Weber. She is the director of the Missouri Poison Center and one of our pharmacists and specialists in poison information who's been here quite a while. How many years have you been at the Poison Center, Julie?
Let's just say I think it's been over 30 years that I've been here.
Great. I knew it was quite a while, and I look forward to hearing about some of the Poison Center history as well as information about what is National Poison Prevention Week, which we'll talk about today. So I'll let you get going on a little bit of the history of America's Poison Centers.
Great. Thanks, Amanda. Yeah, I can't believe we're hitting another National Poison Prevention Week. And believe it or not, more than 2 million cases of poisonings occur throughout the United States every year. So I'm happy to talk about our services today and give a little bit of background. Early in the 20th century, there was no field of early toxicology, no poison centers around, and really frightening to think there was no oversight to any of the drug labeling and very little information about poison treatment. I think that's where the role of pharmacists came in a lot too, because a lot of times it was medications in the home that kids were getting into. And that's what they saw in a study or a survey done in 1950s. Over half of the percent or 50% of children's accidents reported to pediatricians were actually due to a potential poison. So looking at this and really seeing how things came about, the Surgeon General actually established, hearing the results of this survey later that kind of in that century there, National Clearinghouse for Poison Control Centers. And this kind of clearinghouse sat within what we know as the FDA, the Food and Drug Administration, and believe it or not, the U.S. Department of Agriculture. So these were the only two federal agencies related to consumers with jurisdiction at that time over drugs and different chemicals. So poisonings continued in children, and I think about what I always heard when I started at the Poison Center was about how children always got into children's aspirins. They were the Bears Children aspirins, orange, probably no child-resistant packaging, and kids loved eating them. So at a meeting with the American Academy of Pediatrics in 1958, they actually established the American Association of Poison Control Centers. So that takes us to Missouri's history. Cardinal Glennon Children's Hospital, who has hosted the Poison Center in various forms, now known as the Missouri Poison Center. It's been in operation, the hospital, since 1958. And 2 years after the hospital opened, just nurses and physicians in the emergency department would take calls about children being poisoned. And there were actually at that time about 4,000 calls per year that they managed. At one point in time in Missouri, there were up to 15 different poison centers throughout the whole state. So what we saw happen with Cardinal Glennon and seeing the need and having so many children being poisoned, it established in 1974 the Poison Center as an actual department of the hospital. And that was the first time. We started out in a very small space with one nurse and one pharmacist, actually Bob Jager, who was the founding father of our Poison Center, who began operations, and then in 1978 actually established an 800 toll-free technology to take calls from the entire state of Missouri. So beyond just being local in St. Louis, calls opened up to everyone in the state. So during that next time period, we really saw a vision at Cardinal Glennon to support children and anyone with poisonings. And between 1981 and 86, we really worked on becoming the sole provider for poison education and prevention in the state of Missouri. So through our 24-hour hotline, we had both public and professional education. We worked closely with EMS, and we began really collecting data to provide information and inform public health about the types of exposures that kids were getting into. So just to give a little history of my start, I began as a student here in '89, and it was amazing to see that toll-free technology in our system. We had at that point really 2, maybe 3 people sometimes on the hotline, and there were 10 phone lines ringing in at one time. And our only method to triage those calls coming in was really to ask the person to be on hold and to write notes on paper and to help our callers. So we've really expanded our services since that time. In 1999, we went to electronic record keeping, having an electronic medical record. And then also in 2015, we kind of opened up and had established our own internet site. And then we provide services for text, web chat, instant messaging, and we also provide, beyond services for the hearing impaired, a language line. So we serve any population in over 150 languages. So also this last few years, we continue to really try to reach our customers where they are and reach out to the populations that are also getting into things, our teens and tweens. So through our own website, MissouriPoisonCenter.org, we've developed an app, which I'm sure Amanda will talk about a little later. And then also some social media platforms we're on. We're on Facebook, X, Instagram, and actually have an awesome TikTok account to help educate teens and tweens and parents, and provides a really fun educational environment. So from there, our services, we're here about National Poison Prevention Week today, and it all started in Missouri. Believe it or not, pharmacist Homer George in Cape Girardeau, Missouri, established really seeing in the mid-1950s, almost 1,000 kids and younger than 2 were being poisoned each day. So he worked in the area with insurance agents to educate on the proper storage of household chemicals, such as the lye, like the drain openers that have a very alkaline content to it, insect killers, cosmetics, and medications like I talked about, aspirin. So he worked locally with the government and noticed that there were like all kinds of educations. Believe it or not, there was a National Pickle Week and a National Mother-in-Law Week. But he thought to himself, neither of those ever killed anyone. So he worked with Governor Blair at the time to establish a Poison Prevention Week in Missouri in 1959, and then went on to even make it bigger and better. And nationally, he petitioned to have a National Poison Prevention Week, and that got passed under President John F. Kennedy in 1961. So Amanda, why don't you take it over a little bit and discuss what we're doing for National Poison Prevention Week this year?
Absolutely. Yeah. So National Poison Prevention Week started yesterday, and it runs Sunday through Saturday of this week. So we are on day 2 of National Poison Prevention Week. And this year, some of the things that Missouri is doing is reaching out to organizations such as pharmacies to provide magnets in every order that they process this week. So if you have a filled prescription, maybe this week you'll receive a Poison Help magnet. A good resource to pharmacists for medication mistakes or medicine errors. Poison centers can be there to help you with those as well. And we know that, as we've talked about, there are lots of kids who are affected by poisoning, especially biggest population is our kids under 5. So we have reached out to daycares and schools across the state prior to this week as well, and offered our resources to them as well, free of charge. So maybe your preschooler or your young toddler will come home with some material from the Missouri Poison Center this week. I encourage you to post our number, to save it in your cell phone as a contact so that you have that resource if you need us anytime with a poison or even a question related to a medication or other household chemical. We work a lot with our local health departments across the state. They do great work in the communities that they serve through education and services. And so we provide resources and awareness to our health departments, both on a statewide and a local level. And so many health departments have our resources as well as are sharing our social media messages this week. And we appreciate them doing that as well. This week prior to National Poison Prevention Week, there was a national poster showcase and video contest. And that was on a national level to promote awareness about poison prevention. And so there are some winners across the country that are celebrating this week from middle and high school age groups. And we appreciate the students' efforts on those. We are sharing a lot through social media this week. We'll have a couple of new videos as well as new content on our social media pages, as Julie mentioned, Facebook, X or Twitter, Instagram, and TikTok. We'll have some posts about different types of poisonings, as well as ways that you can reach out and prevent a poisoning. And if you do share any of our resources, we encourage, we want the hashtag NPPW24 to go viral, and that's National Poison Prevention Week for the year 24. And so we hope that you will consider using that if you do share any of our resources this week. We also have two exciting things, and I'm not sure how they're going to show up on camera, but I did want to share them with you. And maybe we'll post them also later on our social media. Let me grab it here. The first is a very amazing proclamation from our governor about National Poison Prevention Week. And so we received this to celebrate and to continue the awareness in the state of Missouri about National Poison Prevention Week. And it has the official seal and everything. So we know it is definitely legit, and we will share that with you this week. We also have proclamation from the mayor of Kansas City, an even larger one here, and we'll share those too. So we appreciate our government officials and stakeholders sharing our awareness this week of National Poison Prevention Week. There's so much other things that we can talk about in terms of National Poison Prevention Week. It is really a week to promote the Poison Helpline, and I'm going to put that up on the screen if you haven't seen it on our logo, etc. there. I do encourage you to save the Poison Helpline in your phone. It's can be quite daunting. If something happens, you can get a little bit flustered, and maybe that phone number is not so easy to find in a panic. And I encourage you to save it in your cell phone ahead of time. It's 1-800-222-1222, and you'll have it at your fingertips. I also encourage you to go on our website, MissouriPoisonCenter.org, and right on the homepage is a link to download our app. As Julie mentioned, we have a new app. It's available in Google as well as the other one. What's the other one?
In the Android platform.
Android, thank you. Yes. I can tell which phone I have. And it is available for free. It's a great resource with a quick link to call, as well as a game and other resources. Really helpful to parents, teachers, community members. And so I encourage you to go on our website and to click the link or to scan the QR code to download our app. It's really a great resource, and it's free. And with that, I'm going to be closing up. I wish you a great National Poison Prevention Week and a wonderful spring. And thank you very much, Julie, for taking some time to give us a little history about poison centers and the National Poison Prevention Week.
Well, thanks, Amanda. I want to give a recognition as well to our nurses and pharmacists on the hotline. We have so many years of experience here, and also to all of you who use our services. The public, we have healthcare professionals that call for help, and I really appreciate you supporting us and getting that number. You all do a lot to help poison prevention, and let's keep our kiddos safe, but know we're here for all ages. So from birth all the way up to our seniors, we're here for you guys. So thank you.
Thanks very much. Have a great afternoon.
Thank you.